So today we're going to talk about a story that starts with a single missed diagnosis, but it ends with a vision for a medical safety net that could honestly save countless lives. It's about how one person's struggle can spark a solution for everyone. Let's dive in.
Picture this. It's 2019. A man walks out of his doctor's office feeling that sense of relief. He did his annual checkup, the doctor said he was fine, nothing to worry about. But later, when he looked back at his own lab results, he found something that just made his heart drop. The clues, the warning signs for what was about to happen, they were right there, in black and white.
So fast forward 2 years from that all clear from the doctor. That same man was diagnosed with type 1 diabetes. We're talking a lifelong condition. That means daily insulin shots, constant monitoring. It completely changes your life. And that man, his name is Ermias Wadaje Tegborough. And here's the thing. He's a civil engineer, so his brain works a certain way. When a system breaks, you don't just get mad. You engineer a fix.
You see, Ermias' story, it isn't just about one guy, one missed result. It's about this crack in the system, a blind spot that honestly affects millions of people. And here's the tough part, the really uncomfortable truth. What happened to Ermias? It's not rare. In fact, it's pretty much the norm. Think about it. Doctors are looking at pages and pages of lab results. And when you're under that much pressure, it's just so easy for a critical detail to get missed or for a connection between this year's result and last year's to just not get made. Now, this isn't about pointing fingers. This is not about blaming doctors. It's about really trying to understand the incredible pressure they're working under and the very real human cost of a system that is just stretched to its absolute breaking point. I mean, just let this number sink in for a second. In Ethiopia, and in many places around the world, a single doctor might see 50, maybe even 60 patients in a single day. That's not just a busy day. That is a staggering, almost impossible workload. And let's be absolutely clear here. These doctors are heroes, no question. But they're also human. And what happens when any human is overworked, understaffed, and just completely exhausted? We make mistakes. We miss things. It's inevitable. So what are we actually talking about here? What kind of things get missed? Well, it's stuff like a high glucose level that gets brushed off as just borderline, or low iron that's dismissed as, nothing serious, or a rising HbA1c, that's a key indicator for blood sugar, that just gets overlooked year after year. And the consequences, the fallout from these seemingly small misses, they are anything but small. We're talking about strokes, amputations, people ending up on dialysis, even preventable early deaths. So Ermias, remember, he's the engineer. He looked at all of this not as some unavoidable tragedy, but as what it was, a system failure. And what do you do when a system fails? You don't just patch it. You engineer a better one from the ground up. And that's exactly what he did. He created ISecond Look. Now, it's so important to get this right. This app doesn't replace doctors, not at all. It's designed to be their assistant, their partner. Think of it like a second pair of digital eyes that never gets tired, a safety net that's always there to catch something that a human eye, for totally understandable reasons, might miss. And the way it works, it's actually brilliantly simple, but so powerful. So you take a lab result, doesn't matter if it's typed, printed, or even handwritten, and you just feed it into the app. The app crunches the numbers instantly, and then it gives back this super clear, color-coded report that shows you right away where the risks are. The doctor takes a look at that report, uses their expertise to make the final call, and then they can show the patient exactly what's going on. It's amazing. So you can really see the difference here, right? On one hand, you have a doctor working alone, trying to remember every detail from a patient's history, always racing against the clock. But on the other hand, you have that same doctor, but now they're backed up by data, by historical trends, by instant analysis. The app isn't making the decision. It's empowering the doctor to make the best possible one. Okay, but a fancy app is totally useless if it doesn't work in the real world, right? Especially in the places that need it most. And this is where ISecond Look is just, it's genius. It was built from the ground up for the realities of working on the front lines. I mean, check this out. First off, it works offline. A huge deal when you don't have reliable internet. It can take voice input in local languages like Amharic. How cool is that? It can even check if a nearby pharmacy actually has the medicine you need, in stock, in real time. And get this, it sends anonymous data to the Ministry of Health,
so they can spot disease outbreaks way earlier. It's not just an app, it's like a whole healthcare ecosystem right there on a phone or tablet. Okay, so the tech is amazing, but what does it actually do? What does this mean for a real person, a real patient? Let's look at how this goes from being an algorithm to an actual lifeline.
All right, so let's play this out. Imagine a mom brings her little kid into the clinic. The child has these fevers that just keep coming back. They do some lab work, and the results show low hemoglobin and a high white blood cell count. Now, a busy, tired doctor might see that and immediately think, okay, probably malaria. It's a common guess.
But Second Look scans those same results and flags another, more serious possibility: leukemia. So the doctor sees this alert, stops, reconsiders, and orders more tests. And it turns out the app was right. The child gets diagnosed early and treatment can start right away. That's not an algorithm. That's a life saved, period. Okay, here's another one. A scenario that happens all the time. You have a middle-aged guy, his glucose levels are just a little high year after year, and every time he goes to the doctor, he gets the same advice. You know the one, watch your diet. But maybe it's a different doctor each time, and nobody is connecting the dots over the years. But Second Look does. It doesn't forget. It sees the trend line, this slow but steady 20% rise over 24 months, and it sends up a flag for the doctor. Hey, there's a 94% risk of prediabetes here. The doctor can then intervene before it's a full-blown problem. The man never develops diabetes. That's not just a cool feature. That is true prevention. So you see, this whole thing, this entire project, it's not just about tech. It's driven by this incredibly deep personal mission. It's a vision for how things could be. And now it kind of puts a choice in front of all of us. Remember, Ermias isn't a doctor. He's a civil engineer. His whole world is about building systems that don't fail, about reinforcing weak points. His own health took a massive hit because the system had a point of failure. So what did he do? He set out to rebuild that system. And his motivation couldn't be more simple or more powerful. He says, I built what I wish I had. But look, he can't do this by himself. For this vision to become a reality for everyone, it really needs three things. First, it needs doctors on the ground to actually try out the app, to pilot it, to give that critical feedback. Second, it needs pharmacies to get on board, to join the network so that real-time data is available. And third, well, it needs investors and partners who see what this could be and who believe in the mission. Ermias has to take insulin every single day of his life because one number on one lab report was overlooked. He's not looking for revenge, he's building a solution. He just wants to make sure that every other patient gets the warning that he never did. So you've just heard the vision, and now you have a choice. We all do. We can either watch from the sidelines, or we can decide to be part of the solution.
Because really, the next misdiagnosis, it could be anyone. It could be someone you know, maybe even someone you love. Second Look, because everyone, absolutely everyone, deserves a second chance to see what's coming.